What is the most appropriate initial treatment for a patient with a suspected tension pneumothorax? A. Administer albuterol. B. Perform needle decompression. C. Provide high-flow oxygen. D. Immobilize the spine. Answer: B. Needle decompression is the immediate treatment for tension pneumothorax to relieve pressure on the lungs and heart. A 45-year-old man is unresponsive, pulseless, and apneic. What is your first action? A. Deliver 2 rescue breaths. B. Begin chest compressions. C. Check blood sugar. D. Insert an oropharyngeal airway. Answer: B. For a patient in cardiac arrest, immediate chest compressions are the priority. Which rhythm is considered a shockable rhythm in cardiac arrest? A. Asystole. B. Ventricular fibrillation. C. Pulseless electrical activity. D. Sinus bradycardia. Answer: B. Ventricular fibrillation is a shockable rhythm using a defibrillator. What is the normal range for an adult respiratory rate? A. 6 to 12 breaths/min. B. 12 to 20 breaths/min. C. 20 to 30 breaths/min. D. 8 to 16 breaths/min. Answer: B. The normal adult respiratory rate is 12 to 20 breaths per minute. What condition is characterized by chest pain, shortness of breath, and ST elevation on ECG? A. Congestive heart failure. B. Asthma attack. C. Myocardial infarction. D. Angina pectoris. Answer: C. ST elevation on ECG indicates a myocardial infarction, heart attack. A patient with hot, dry skin, altered mental status, and a core temperature of 106 degrees Fahrenheit is likely suffering from A. Hypothermia. B. Heat exhaustion. C. Heat stroke. D. Febrile seizure. Answer: C. Heat stroke presents with elevated body temperature, altered consciousness, and dry skin. What is the correct compression to ventilation ratio for 2 rescue or CPR on a child? A. 15:2. B. 30:2. C. 5:1. D. 10:2. Answer: A. For 2 rescue or CPR on a child, the ratio is 15 compressions to 2 breaths. What is the most reliable method of confirming endotracheal tube placement? A. Chest rise. B. Tube fogging. C. Capnography. D. Pulse oximetry. Answer: C. Capnography measures exhaled CO2 and confirms correct ET tube placement. Which of the following patients is the highest priority for transport? A. A child with minor bleeding. B. An adult with a sprained ankle. C. A patient with a possible stroke. D. A conscious patient with a dislocated shoulder. Answer: C. Stroke is time-sensitive and requires rapid transport to a stroke center. What is the most appropriate treatment for a severe allergic reaction with respiratory distress? A. Administer diphenhydramine. B. Provide oxygen only. C. Administer epinephrine via autoinjector. D. Place the patient in recovery position. Answer: C. Epinephrine is the first-line treatment for anaphylaxis with airway involvement. What is the term for a bluish discoloration of the skin due to hypoxia? A. Pallor. B. Cyanosis. C. Flushing. D. Mottling. Answer: B. Cyanosis is a sign of inadequate oxygenation, typically visible in lips or fingertips. In which position should a pregnant woman in her 3rd trimester be transported? A. Supine. B. Semifowlers. C. Left lateral recumbent. D. Prone. Answer: C. The left lateral recumbent position prevents compression of the inferior vena cava by the uterus. What is the first step in controlling external bleeding? A. Apply a tourniquet. B. Elevate the limb. C. Direct pressure. D. Apply cold compress. Answer: C. Direct pressure is the first and most effective method to control bleeding. Which of the following is a symptom of compensated shock? A. Bradycardia. B. Hypertension. C. Confusion and restlessness. D. Cyanosis. Answer: C. Restlessness and anxiety are early signs of compensated shock due to poor perfusion. What is the appropriate depth for chest compressions on an adult? A. At least 1 inch. B. 1.5 to 2 inches. C. At least 2 inches. D. Exactly 3 inches. Answer: C. Adult chest compressions should be at least 2 inches deep to generate adequate circulation. Which of the following findings suggests a traumatic brain injury, TBI? A. Pupil reactivity. B. Blood pressure of 120/80. C. Altered mental status and vomiting. D. Clear speech and alertness. Answer: C. Vomiting and altered mental status are signs of possible increased intracranial pressure. When assessing a pediatric patient, what is the most reliable indicator of perfusion? A. Capillary refill. B. Skin turgor. C. Pupil response. D. Heart rate. Answer: A. Capillary refill time is a reliable and fast indicator of peripheral perfusion in children. What is the correct procedure after an AED advises a shock? A. Resume CPR immediately without shock. B. Deliver the shock, then resume CPR. C. Wait 5 minutes. D. Reassess breathing. Answer: B. After delivering the shock, resume chest compressions immediately for best outcomes. What is a sign of hypoglycemia in a diabetic patient? A. Slow pulse. B. Warm, dry skin. C. Confusion and irritability. D. Hypertension. Answer: C. Confusion, shakiness, and irritability are early signs of low blood sugar. A patient exposed to a toxic chemical is coughing, has wheezing, and shortness of breath. What is your priority? A. Decontaminate the patient. B. Administer oral glucose. C. Immobilize the patient. D. Apply a tourniquet. Answer: A. Remove the source of exposure first before beginning other interventions. A person has suffered a high-voltage electrical burn. What is your first priority? A. Start CPR immediately. B. Disconnect the power source. C. Apply burn dressings. D. Apply cold water. Answer: B. Always ensure the scene is safe and electricity is turned off before touching the victim. What is the most appropriate method to open an airway in a suspected spinal injury? A. Head tilt, chin lift. B. Jaw thrust maneuver. C. Bag valve mask. D. Mouth to mouth. Answer: B. Use jaw thrust to open the airway without moving the cervical spine. When suctioning an adult's airway, how long should you suction at one time? A. 5 seconds. B. 10 to 15 seconds. C. 20 seconds. D. 30 seconds. Answer: B. Limit suctioning to 10 to 15 seconds to avoid hypoxia. What is the EMT's primary responsibility at a multi-casualty incident? A. Treat the most injured patient. B. Begin CPR on all victims. C. Triage and call for resources. D. Interview bystanders. Answer: C. The EMT must quickly triage patients and request appropriate resources. What does SAMPLE stand for in patient assessment? A. Signs, airway, motion, pulse, level of consciousness, EKG. B. Signs/symptoms, allergies, medications, past history, last oral intake, events. C. Safety, alertness, medications, pain level, lung sounds, environment. D. Shock, assessment, medical care, positioning, life threats, evaluation. Answer: B. Sample is a mnemonic used to gather essential patient history information.